Welcome to Emmanuel Medical Center. My name's Dr. Kutesa William. I'm glad to inform you that at Emmanuel Medical Center we have a fully equipped and functioning theater where we carry out a number of theater procedures ranging from minor to major operations. The surgical operations that are carried out at Emmanuel Medical Center, they include hernia repairs, appendectomies, operations on patients who have had intestinal obstructions, cholecystectomy, that is removing the gallbladder which is diseased or which is having stones. We also carry out hemorrhoidectomies. We carry out excisions. We also have we carry out obstetric and gynecological procedures, which include evacuations, Cesarean sections, myomectomies, hysterectomies, cystectomies, and a number of other gynecological procedures. We also carry out orthopedic operations for those patients that have had fractures. We do have visiting orthopedic surgeons, so we can carry out a number of orthopedic operations for people with fractures. Then we also have, we do carry out plastic surgery. We have plastic surgeons, visiting plastic surgeons who come. So in case a patient needs plastic surgery, still it can be carried out at Emmanuel Medical Center. Our theater is well equipped with the necessary equipments and machines that we need to carry out all those operations and procedures. I've just mentioned a few, but we carry out all the major operations and minor operations that can be done. Among these operations, we have the emergency operations and then the elective operations or procedures. For an emergency operation or procedure, that is an operation that has to be done immediately. If in case it is not done, then the patient's life is in danger. The patient is at risk of losing his or her life. So the procedure has to be done as soon as possible. Those are what we call the emergency operations. They are common like in obstetrics, but they can also happen, obstetrics, you can have the gynecology, you can have ruptured ectopic pregnancy, that one has to be done immediately. You can have fetal distress, obstructed labor, and the other emergency operations that have to be done. So for those ones, you don't have to wait. For elective procedures, those are surgical procedures which have to be done, but they can be scheduled. The patient is not in immediate danger, but still the operation has to be done to improve the patient's health status or health condition. So that one you can plan with the surgeon or the person who is going to do the operation, and it is done at the most convenient time possible. So that is what we mean by an elective procedure or operation. And in case you have an emergency at home that needs quick transportation or that needs supportive care while being transported to the hospital or to Emmanuel, we have a 24-hour ambulance service. So you just have to call the receptionist for the ambulance to come and pick you wherever you are, so that the patient is transported quickly to the facility and is given the necessary emergency care in the emergency room. We have a well-equipped emergency room that takes care of patients in emergency conditions. Thank you very much.